this is probably the perfect segue for Leah.
Well, the movement of what's called consumerism, the growth of high-deductible health plans that we've been talking about this morning, is what I like to think of as a plot twist in the Affordable Care Act saga. We thought the Affordable Care Act was all set up to be about managing care better, moving away from fee-for-service to value-based purchasing, really being able to be more sensible about how we invest healthcare dollars to achieve the ends we want to achieve, both in terms of cost and quality. But in the meantime, through a variety of forces, we ended up with, particularly among the private sector employers, this incredible tsunami of change around high-deductible health plans. I mean, the numbers on the shift to high-deductible health plans are extraordinary, just the ones we know about, and certainly every purchaser that I talk to is either moving toward them very rapidly or already gone fully toward high-deductible health plans. This is a massive shift in the way consumers are approaching their health care, and it's very different from what we anticipated with the Affordable Care Act. And I think, as others have pointed out very well, for consumers, value is sometimes very different from what it is for purchasers. Sally and I were talking about this at lunch. Sometimes consumers may not be able to assess value the way a purchaser can. They may, for example, think that their surgeon is just great, even though the numbers just don't bear that up, but they think their surgeon is. At the same time, we do have to value the opinion of consumers. Obviously, they are important. Patients are critical. They should be at the center. So what matters to them should matter to us. But the question of how we balance between the role of purchasers in value and the role of consumers in making decisions and having the tools they need in the world to make these decisions is really critical for us right now, which is why this conference is really helpful. So with price transparency, what we find, and I think there's a growing body of literature on this, is that price is never enough for consumers. The second question after you know the price is, or you think you can get the price, whatever it is, the second question is always, what do I get for my money? And we know that's true from common sense in our own lives. You know, nobody walks into a car dealership and says, here's $20,000, give me a car. Right? We say, what do you have for that? And then you evaluate the quality of the vehicles that are available for whatever it is your budget is. It's the same thing. It's always the second question. There was a study in the Journal of Patient Safety recently which did ask consumers if you were given information about cost and information about safety. We like this study because we were surprised actually to read it. They used the hospital safety score, which is Leapfrog's letter grade that we assign to general hospitals on how safe they are for patients. It's called the hospital safety score. And they said, if you could have this letter grade and you could have this costing information, which one's more important to you? And they sort of evaluated how consumers would make decisions. And 97% of the time, they would make the decision based on the safety score. So they really did feel that quality was of paramount interest. But whatever it is, they want both pieces of information, however they choose to go forward. And so transparency and good quality transparency and safety transparency is critical. But we certainly are nowhere near where we need to be. We try to help at Leapfrog, and we've come a long way. And there's others like Castley, as a good example, who have come to the table to really try to make sense of an enormous amount of data for consumers. Those are good trends. We need to move much faster on them. But transparency is also not enough, and consumers do need the purchasers to get involved, and they need to be much more aggressive. And I'm going to give you an example of why. There's many examples, but let me give you one, and that is the issue of patient safety. There was a study that was done in JAMA. It was in 2013, and it looked at what is the price, how much extra do certain purchasers pay when there's a surgical site infection on a patient in this southern hospital system. So it turns out Medicare paid $3,000 more for the procedure on average every time there was a surgical site infection, which is a lot. But purchasers, commercially insured purchasers paid $39,000 more every time on average there was a surgical site infection. $39,000 is a lot of money. And the value to a purchaser for a surgical site infection is zero, right? You don't want to, do you want people to price shop infections? Do you want them to say, oh, but it's only $30,000 to get an infection there, as opposed to 39 of it? No, there's no value to it. What you want is for your employees to go to a place that has fewer of them. And that's not easily apparent on claims data. You're going to need to push your leverage as a purchaser to make that happen and get that data. One way is through Leapfrog. We're a nonprofit, and we, on behalf of purchaser members, go out and ask hospitals for that data. But there's so much confusion about the role of purchasers that I recently had an experience where we were in, I was with 4 executives from 4 companies that were the largest purchasers in this beachside community. And we went to the hospital that serves most of the residents of that beachside community. One of their lobby looked like one of those hotels in Libby Rosenthal's website, with like a cascading waterfall. It was the fireplace. It was gorgeous. So we went in with these 4 employers and said, these 4 employers would like you to report your infection data and other data to Leapfrog. And the response from the hospital was, well, it's a lot of work, and we have to tell you that we've really had to decide to prioritize those who are paying our bills. So we're not going to have time for Leapfrog. Now, I would like to say that the employers jumped up and said, what are you talking about? We pay bills. But they didn't. It was left to me to say it. And then they said, oh, right. They said, no, we mean the health plans. And so we had to say one more time, I'm sorry, the health plans don't pay your bills. These 4 purchasers pay your bills. But the market is so confused about who's the payer, who actually is paying the bills, and to whom do providers need to be accountable, that this kind of a scenario is even thinkable. So we have a long way to go, and purchasers need to step forward, because if they don't want their employees to get a surgical site infection, it's not enough just for them to be good consumers with great transparency tools. The purchasers have to leverage their buying power, however they can do it, to make sure that they protect their employees and get them the best quality, highest value care.
Thanks so much.